Hi, I'm Van Brienne, and I'm going to tell you all about breast cancer. We are going to talk about all the pre-op bullshit. Bullshit. It's a lot. It exhausts me just thinking about it. I'm very new still at this, so I guess I'm supposed to tell you to subscribe and hit the little notification button, even though YouTube doesn't send you notifications anymore. So, even if you do that, you won't know if I post new videos, so you have to log on to YouTube and you have to check to see if I've posted a new video. Like, what is the notification button for if you're going to change the algorithm? I will literally bitch about this in every video. Be prepared. Okay, moving right along. So, my appointment for my double mastectomy and the beginning of my breast reconstruction, which takes several surgeries, is T-minus 10 days, ladies and gentlemen, and I'm freaking out, honestly. Covering with sarcasm, as usual, pre-op. All this stuff needs to be done before your surgery. You need to be cleared for surgery and make sure that you're fine. So the first thing they do is both offices order a bunch of tests. I have to go to at least 4 different appointments. So yesterday I had my appointment with my primary care doctor. They do a couple tests there. They also order blood tests and other scans. So I had an EKG at my primary care doctor's office yesterday. The EKG makes sure that your lungs and your heart are working properly. That one's pretty self-explanatory. They also just check vitals, listen to your lungs, everything primary doctors usually do. The hospital where I'll be having my surgery contacted me and scheduled an appointment for the 16th. Today's the 11th, and they will be doing a COVID test, and they will be doing a pre-surgery assessment, I guess they called it, to clear me for surgery. Basically asking me about my medications, making sure they're aware of everything, since they'll be taking care of me for a few days after surgery. They need to know what medications I'm on and, you know, how to handle certain things if I have other medical problems, which I do. So, which they said would take like 2 to 3 hours. Super stoked about that. Also, blood tests were ordered, so now I have an appointment on Monday, day after tomorrow, for this whole blood work panel. Now we can just briefly go through what kind of blood work and why they need this kind of stuff done. Okay, so they do a comprehensive metabolic panel. This is a blood test, and they check like for your body's fluid balances, basically. Like electrolytes, sodium and potassium, kidney and liver functions, etc. is what that is, just checking all of your organ functions. They also do a complete blood count. So it's like a white blood cell count, which checks for anemia and infection and so on and so forth. I'm going to try to say this right. Prothrombin. Yes! Prothrombin in PTT. That basically checks your blood clotting time. So they're looking for things like clotting disorders. They're making sure that you can clot well, since they'll be doing surgery on you for 5-6 hours. They also do an HCG blood test, which checks to see if you're pregnant. I guess it's more accurate and can tell within a shorter period of time. Oh, God, my eyeball itches. Shorter period of time than a urine test. And they can actually tell, if I understand it correctly, what age the fetus actually is. They're also going to do a urine test checking for kidney disorders, urinary tract infections, liver disease, diabetes, base cells, yeast and bacteria, etc. And last but not least, they do a chest x-ray, which checks for an enlarged heart or fluid around the lungs. And the chest x-ray can also determine whether you have cancer there, I think, because remember, with breast cancer, it can travel, it can metastasize to usually the bones, the lungs, and the brain are the three main places. So I believe the chest x-ray can see if it has metastasized to the lungs, if it's there. But obviously they're checking everything in your chest because that's where the surgery is going to be too. Pretty much. So yeah, I had my primary care appointment yesterday. And the x-ray is a walk-in. So basically I'll have to go, I have an appointment to go and have the blood work done on Monday. And then I can, whenever that's done, it can take a couple hours. And blood work and urine analysis and everything. I can drive from there to the x-ray place and then just sit and wait. So Monday is going to be a long day of just tests. And then Valentine's Day, and then a couple days later I'll go in on the 16th to the actual hospital and do the whole COVID test and pre-assessment, and that'll take hours.